It used to be that if the nursing home was missing medication, let's say that somebody missed medication, they couldn't figure out what they got, or Aunt Judy who put somebody in a nursing home, or Mom Judy, or daughter Judy put her mom in the nursing home. Mom's complaining that her pain's not well treated. It used to be that, if an employee took some of that medication, it was on the employee. The Department of Justice has changed. The Department of Justice says, no. You're violating the Controlled Substance Act because you guys are responsible for the meds. And so they're going after the nursing home. They're certainly going to go after the person who stole the meds, who diverted the meds, but they're also now chasing the nursing home. And that's a big deal because that can make you lose your facility. And it may be, and you never know this, it could be several people involved in diverting. And it doesn't necessarily have to be just pain meds. It could be things like trazodone. It could be something like gabapentin. It could be some other high-value medication that has a street value. I mean, I've even seen insulin being diverted. So drug theft is a big deal. And they're not just chasing the person who did it. They believe, the federal government, that it's the responsibility of the nursing home or the assisted living facility to be fully responsible for any medications that are within their purview. Any medications that are within their control or on their facility or in their facility are the responsibility of the facility. And that really poses a very significant challenge for nursing homes that's new. We certainly know that the majority of people that drug overdose don't do it from the medications that are prescribed, but there's a whole trade in medications. So sometimes nursing home patients will trade amongst themselves, and you wouldn't think that would be very common, but we've seen it, and we've seen deaths, and we've seen nursing home patients trying to help another patient, saying, hey, take my meds. It looks like you're more uncomfortable. And that trade sometimes leads into overdose and death, and the facility is responsible for that. So these are all things that need to be monitored. Most nursing homes don't do that. I can tell you it's a rarity that a nursing home actually monitors for urinary toxicology inside their facility, or saliva tox, which is more specific, and it can be done in an observed way. There's thousands of cases now where there's a transfer of narcotic in exchange for sex. And the Department of Justice has taken notice of this. These theft rings are everywhere. And you wouldn't think that the older population would be involved in this, but it's a big deal. In fact, the #1 growth rate of STDs in the United States is in the nursing home population. What we want to do is have our patients be prescribed safely. So we created CareGuard SafeRx, and it's a way for us to ensure that those patients are getting their medications. It's a way to verify through remote therapeutic monitoring, to remote monitoring by saliva or urine, gathering data to confirm that they got their actual medications. And we can measure things even like beta blockers. We can measure things like blood pressure medicine. We can measure things like insulin. We can measure a lot of the compounds that most people don't even think about. The reason why we do this is because we want to keep our patients safe. We don't want to have issues of theft. We want to build trust with our folks, and we want to build trust with the family. And we want to make sure that there's an accountability, and God forbid there is an event, we've already taken action in advance, and we have a process and a system to deal with this. So STDs, like I said, are now considered a sign of nursing home neglect. It is the same as getting a giant wound and not moving the patient for 5 days, or having them covered in stool and getting infected, or a bus dropping the patient out of a wheelchair onto the ground. It's neglect. Nursing home patients should not be getting STDs. It's as simple as that. Now, here's the problem. A lot of nursing homes don't check their patient coming in. So you wouldn't know this, but a lot of patients already have STDs. And when I talk to doctors that take care of nursing home patients, they rarely will order an RPR on their patients looking for syphilis in advance. They will rarely order an STD test in advance. I mean, how do you know the patient doesn't have a chlamydia? How do you know they don't have active gonorrhea? How do you know they didn't have neurosyphilis? I see this every month. How do you even know that they didn't have tuberculosis? I see 3 to 5 cases of tuberculosis a month, and that's a big deal. It's really important to get ahead of this issue. Like I said, it's the gonorrhea, chlamydia, and syphilis. The highest growth rate is in the older population. They're making the youngsters look like they aren't doing anything. And so these growth rates are tremendous. And those are the things that we have to be very aware of, because the CDC certainly is compassionate about making sure that things get treated. But the Department of Justice has a task force that's specifically looking for this. And if you can show that you're preemptively and preparing yourself for a potential problem, then you don't have any issues. It's the issues that occur when you don't do anything about it. Now, you wouldn't think this would be a big deal. Minimum staffing standards. We all want to take amazing care of our patients, but Medicare, the Department of Health and Human Services, has put in a minimum staffing standard. This minimum staffing standard is going to gut a lot of nursing homes. What they're trying to do is they're saying that we aren't paying people enough money and we don't have enough workers. What they're ignoring is there may not be enough workers that are qualified to work. And currently, on average, nursing home RNs earn $40 an hour. An LPN makes $31 an hour. A nursing assistant currently makes $19 an hour. That's a 27% increase since February of 2020. Have your rates gone up 27%? I doubt it. In fact, nursing home rates are flat. They've barely kept pace with inflation, and actually are probably a little bit less than inflation. CMS knows that this is going to cost $6 billion. It's an unfunded mandate, but it's already passed. So now we have to figure it out, and we have to make sure that we can adjust and compensate. But that's not the big deal. The big deal is that they want the salaries of the workers to be 80% of what Medicaid would have paid on a wage rate. So if you run a regular skilled facility, they want 80% of the money that you earn to have gone toward worker wages. Right now, that cost is probably about 40%. And you've got other costs. You've got utilities, you've got rent, you've got ancillary service, you've got to pay for food. You've got a whole host of other things that have to be done. But they want 80% of that cost value to go toward workers' wages. And there's no way that it's going to happen unless you can keep your facility full. You have to keep it as full as you can, because if you're running a 92, 93, 94% occupancy and it's costing you $4,000 or $5,000 per bed to fill, and the turnover is high because you've got urosepsis and you've got upper respiratory tract illnesses, and the return rate from the hospital is low, it's going to be a problem. You may not survive. And that's why we're seeing issues at nursing homes where they're not able to survive. And differentiating yourself and making yourself more visible to the client is the key element. And then reducing your cost is the other key element. And that's what CareGuard's for. That's what we've designed.